I'm pleased to join you in this occasion together with Omicron Kind's mission. In this mission, we found the noble elements of diversity and inclusion and the sharing of information. But the element that I'm most fond of is the dedication to advocating for the vulnerable. I'd like to commend you all for taking up this work under the banner of serving locally and internationally. I'm the founder and chair of the Health Education Action League for Haiti, known as Heal Haiti, whose mission is to train and mobilize young leaders like you to deliver health care and save lives. The inspiration to convene a team of professionals to establish this organization came from the same desire to serve the defenseless community. My turning point was during my experience as a nurse first responder of the devastating 2010 earthquake in Haiti. While working with volunteers and nurses based in Haiti, I understood how globalization affected the ability of young people to deliver quality health care. I asked a young boy to assist me in giving a bed bath to a victim just pulled from the war. Reluctantly, he followed my instructions. Then I was called, as always, busy. We know we nurses, we're always busy. I left him. I was called to another task. And when I returned, I saw a comfortable, clean patient in a tidy environment and joyful tears in this young man's eyes. I understood the demand for the world to come to him through healthcare education. I understood how advances in one area in the world creates gaps in education in another. And I understood how the gaps can mean sickness or health. And I would later find out what I understood, guys, was called global health. So, for the next 10 minutes, please bear with me. I would like to explore a brief history of global health and the implication of global health on the nursing profession. Global health has developed during the Industrial Revolution and all the urbanization it imposed. More people were moving to cities and gaining the ability to commute. This made the world smaller, so to speak, and made disease more communicable. As a response, more research was done to understand how health works. But before then, many people believed the miasma theory that asserted that epidemics were caused by decomposed matter floating around and caused by air. Therefore, the disease was not communicable then. If they're floating around, it's not communicable, so the whole space has it. But we even get the name for malaria from this bad air theory before it was understood later on that mosquitoes spread this disease. So the resource gained from industrial revolution aided in financing research to alleviate the ill effects. So in the mid-19th century, the germ theory disease replaced the miasma theory, and global health was born. First international sanitary conferences was held in 1851. It also led to the Pan-American Health Organization in 1902, and the Office of International Hygiene Publique was established in 1907. At that time, the League of Nations Health Committee also addressed global health. But this organization was dissolved and reformed now into the World Health Organization in 1948. In 2015, an analysis of 32 World Health Organization documents produced between 2007 and 2012 found that the key global issues of concern to nurses at the global level are the workforce, the impact of nursing in healthcare, professional status, and education of nurses. International alliances can help advance nursing, but the visibility of nursing in the World Health Organization has room for growth. Nurses have tremendous opportunity to lead and shape what it means to be a nurse from a global perspective. In addition to professional restructuring, the future of nursing in global health lies in strategic actions regarding student-centered educational system, the environment in which nurses practice, and the way nurses lead. Nurses are uniquely positioned to play a pivotal role in global health. The Nursing of Women's Health Journal recognizes that nurses are ideally positioned to screen, identify, care for, provide referral services for, and support victims for human trafficking. Emerging infectious diseases, maternal newborn health, and health equity are another aspects of global health that nurses are best suited to address. The Global Advisory Panel on the Future of Nursing are organized in 2013 to guide a voice, a vision for nursing that will play a part to the advancement of the profession's contribution to global health. Remember that. We cannot talk about nursing global health without mentioning the National Institute of Nursing Research, right, Dr. Cayo, emphasizes the scientific values of nursing profession through research for delivery of evidence-based global nursing care. The global nurse will remain culturally sensitive, collaborative, and continue to be aware. Remember that diseases have no borders. At Haiti, we proceed to develop training programs to build a healthcare literacy in over 150 nurses and public health professionals. Much like Omicron, Sorority, we are also providing nursing scholarships. We equip our students with the increasing global environment knowledge. I found out to gain this knowledge that can be to positively affect in my hometown, my motherland. It is up to us to live and embody the mission of Omicron Kai Kai for the next generation of nurses. In conclusion, as many of you probably know, I was born and raised in Haiti, but I'm going to share something. I came to the United States, I was 19 years old. I knew nothing about fraternities and sororities. So, nursing is a profession that brings people from all walks of life and from every corner of the world for the common mission of caretaking. Nurses are the primary and persistent people delivering quality health care across the continuum. Now, nurses are called upon to think and act differently in today's environment that is growing beyond hospital walls. In the future, nurses can lead interprofessional approaches to healthcare that have never been done before. Nurses are positioned in settings such as government boards, public health, academia, clinical care, leadership, and private industries, and so on, with the ability to develop a creative and effective network to respond to the multifaceted problems of the world. Dear nursing students and nurses of Omicron Kai Kai societal sororities, let's remember that you are guided by this motto: service for humanity. Please keep your mission under your belt. We need it. The world is dependent on you. And I must add, I must reinforce, I must add a little salt and pepper with the words of Paul Farmer, who says, the essence of global health equity is the idea that something so precious as health might be viewed as a right. Underserved population, they need you. Please make this right become the normal, that they have it. Make this right to become we nurses, that we know that it's not a matter of rights, it's a matter of will. They need it. I'm asking each and every one of you, let's spread the word. Remember what you have learned, your mission again and again. And I must tell you, thank you all again for this invitation and the opportunity to learn and build with you what sorority is all about. Oh my goodness. Thank you so much. I will continue to enjoy this wonderful event with you this afternoon. And if anyone, I'm here, please reach out to me if you'd like to connect and collaborate with me. Thank you so much, and merci, merci.